Hello, welcome to the CIRS Healing Collective Expert Guest Video Series. I'm Jenny Johnson, the host and facilitator of the CIRS Healing Collective, which has been a resource for aspiring CIRS overcomers to share and connect from around the world since 2020. I'm a Shoemaker Proficiency Partner and CIRS coach, and most importantly, an overcomer myself. What you're about to see is a 10-minute excerpt from a 90-minute group discussion that members of the CIRS Healing Collective got to have live with this expert guest. If you would like to see the full 90-minute replay, come on over to the CIRS Healing Collective. We have a robust video library from the past 5 or 6 years of so many expert guests. Better yet, you'll be able to join our future monthly live discussions with experts to come. We'd love to have you.
So how I talked about the fact that when I do an evaluation, we're looking at everything. And then if we find yes, and we confirm that CIRS is there, we're shifting our focus at that place. But what I love about this graphic is that it's saying your microbiome throughout your body is absolutely important for you to get a hold of so that you can address the biotoxins and be able to have your immune system not have so much to deal with. That's really the biggest issue, is that when you're dealing with biotoxins externally and internally, you are also wanting to address any other immune system trigger, our perpetuator. And so that becomes the first focus, is getting a hold of that. So I want to go ahead and shift gears here, and let's talk about one of the greatest tests that we can do, and that is an MRI. And this is pretty much a traditional type of MRI initially, meaning that you as the patient won't feel anything really different about your actual test. You'll go to the imaging place, your provider will order this specific one. And so from your standpoint, it'll seem like a pretty typical study. But behind the scenes, there are some specifics about how we order it so that we get this particular report, because this report is really an important one for us to understand more about how your brain has already been affected. And there are some specific fingerprints with this test that can point us to confirmation of what and why you're having some brain changes and cognitive changes. And it can also be a fantastic tool for us to track your progress over time. So as we get you closer and closer to addressing all the different issues that you might have.
Is there anything that would be mostly safe and helpful for all of us if maybe we don't have a ReCODE report that we could do to help our brains?
Yeah, I think one of the biggest things you can do is to help your microbiome. And when I say microbiome, I'm meaning your gut, but not just your gut. So I want you to think a little bit larger in your whole body. So I'm wanting you to think, what is your gut health like? And you might not have symptoms. I would say some of my sickest patients with their cognition, almost all their symptoms were cognition. They didn't have constipation or indigestion or diarrhea. So even if you aren't having those symptoms, I still want you to pay attention to doing some key things for your gut health. But so before we dive into those specific treatments, so gut, it could be oral, it could be intranasal or sinus. And it could be some other areas. Sometimes people have urogynecologic issues, so maybe some recurrent UTIs. So when you are thinking of your overall health, I want you to think of all of those areas. So that's an important thing to think about, especially if you don't have access to all the testing. So if you don't have access to all the testing, let me give you some ideas of what you can do straight out the gate. So one of the biggest things that we do when we do test the gut microbiome is we determine, do you have too much bacteria or fungus or parasites, or do you have not enough? And actually what's harder is if you don't have enough, because we can deal with it when you have too many. So when you're thinking about if you don't have enough, and you might not know that, right? But the biggest thing you can do to change your gut microbiome, I think you'll get a clue on this and kind of like it. There's really only two ways to change your gut microbiome, and that is eat a lot of vegetables. And if you're not a person that likes that, then you can actually have a fecal transplant. And that's a whole new thing, right? And are you aware of that too, Jenny? And does anybody have questions around that?
Fecal transplant. I've only heard of people doing that in extreme cases of like C. diff and, things like that, where they really didn't have any other options. But you're saying if you have a microbiome, a gut microbiome that is just kind of shot, maybe you've taken antibiotics for Lyme disease for many years or something, where it's just not coming online with probiotics and eating healthy, you can have a fecal transplant and basically acquire somebody else's healthy biome into your own body. Do I have that right?
Yeah, that's absolutely correct. And we're seeing this more and more used for these type of immune injuries, and specifically for different types of cognitive health issues. And there are groups that actually will do this where they will custom test you and someone close to you, because it's actually better to have that fecal transplant from someone nearby you. And there are ways to do that. So that's kind of a more up and coming treatment. But I think that, just putting that into play, either you can eat a lot of vegetables or you can have that, which is kind of a big deal. So maybe as long as you feel decent and good and you can keep advancing your dietary approach, that's a fantastic way to do that. Okay, other ways to do that. Probiotics, right? A lot of people talk about probiotics. So where does that fit in? So as you're thinking about probiotics, you want to also think about this, because if you have probiotics that are important, so I want you to all have lactobacillus species, specifically rhamnosus. And the reason why I want you to have lactobacillus rhamnosus, is because there's a lot more data about helping that gut-brain connection, especially in CIRS if you're having a lot of anxiety, PTSD type symptoms. That's a great thing to have. And then bifidobacterium is actually really important too. So those two families of probiotics are really key. But one more tip, and that is that prebiotics. So prebiotics are actually fiber, and they're fertilizer. But sometimes we'll have a person wait a little bit and not give that fertilizer, because you might be feeding the weeds, if you will. And so you want to have a kind of a strategic fashion. So start changing your diet. As long as you feel good, you don't have bloating, then great, add some more fiber. And if you do feel worse, okay, maybe you need a more strategic approach or have some testing done.
Awesome. Thank you. That's a great tip. So prebiotics feed the healthy microbiome that you're trying to accomplish by taking the probiotics or having your fecal transplant or having fruits and vegetables if you can tolerate those. Awesome. Anything else, Julie? Maybe jumping to another category or just something else, like an easy tip for those of us who maybe don't have access to somebody like you yet, to do all the testing. Any other gadgets or simple free things that we could do that you see as like a big bang for the buck for brain health?
Yeah, I would say that a lot of times in CIRS, there's so much stress and anxiety. I know you do a lot of work with the vagal nerve, and that's absolutely key. Something as far as a device that you can use is Brain Tap. I do see that moves the dial for some people. The other thing is, if you do have access to red light, it actually does have penetration into some of the tissues of our brain and can actually provide a calming nature and a focus. So just speaking about the brain in particular and how those neurotransmitters are working, you can make changes just in doing those types of things. So those are some other things to do.
Red light and brain tap makes me think of the microglia and how they tend to get easily provoked, and then they can kind of run rampant. As I was listening to you talk about the microglia and the brain and kind of wanting to keep them in their Goldilocks state of happy, because that's when they're doing their job of kind of keeping everything all tidy and well functioning, taking care of our nerve cells. But when they get provoked and kind of agitated, they make a mess of things. It made me think of, when we're in the parasympathetic state and everything goes well, and then we get into sympathetic or fight and flight, and like wonky things start to happen. And it's meant to be temporary, but sometimes we get stuck there too long. And I almost feel like the microglia get stuck in fight or flight like we do. It's truly our nervous system in our brain that is in fight or flight and making a mess of things.
It does, and it's a really great analogy, and it can get stuck, and then everything that we can do, because we, in CIRS, we know that nutrition is absolutely important, but does it actually heal you? Unfortunately, it doesn't by itself. However, if you just, abandon all of that, it would decline you. So yeah, super important.
So brain tap and red light therapy, would you say that they can help calm the microglia or at least calm neuroinflammation?
Yeah, so the things that can calm the microglia, these types of energy can. So you can do the brain tap, you can do the red light, you can do a pill that you can have prescribed called low-dose naltrexone. So that has also been shown to reduce the activity of the microglia. So those are some solid starts for you as you're doing that journey, remembering that you're not going to overcome an exposure by those things. But at the same time, I do have a lot of clients who it takes a little bit to get out of their exposure, but these things can help mitigate. So I would still say do them. You're going to have some improvement with that.